Hello, this is Dr. Sukalyan Purkayastha. I'm a neurointerventionist in the Institute of Neuroscience, Kolkata, and today I'll be talking about spinal dural fistula. So this is a bit complex term, but essentially it means an artery and vein abnormal connection on the surface of our spinal cord, right? And the endovascular treatment, in my experience, I have seen almost 100% of the patients they get cured with endovascular means. Of course, there is an alternative treatment available, which is an open surgery. But in endovascular treatment, we don't have to cut open. Without any incision, we can cure those fistulas. So in my slide, you can see that there is a cartoon where there is a connection between the artery on the surface of the spinal cord and there is a draining vein which lies on the surface. The connection is actually on the in an area where it is entering the spinal canal. And what happens really, because there is a connection between the artery and the vein, there is increased venous pressure. And when there is increased venous pressure, there is accumulation of water in the spinal cord, and that's how the spinal cord ceases to function. So what happens? It usually presents with middle-aged male patients. Females are very less affected, and they present with constipation, difficulty in passing urine, and very gradual onset of bilateral leg weakness, both leg weakness. So by the time the disease becomes very severe, the patient usually goes to a doctor, because they think probably it is happening because of some old age or because of some weakness in the leg, which can go with some exercise, but the disease lies in somewhere else. So although it affects both the legs, the disease is in the spinal cord. So again, the MR imaging is the single most important modality, and you should do an MR. And what we see the whitening of the spinal cord because of accumulation of water inside the spinal cord, and on the surface of the spinal cord we see very tiny vessels, and that is the characteristic MR finding of spinal dural fistula. And again, without wasting any time, we should go for an angiogram. You can see that in my slide. There is an angiogram. You can see the artery and the fistula and the vein on the surface, and how we block the fistula with glue. And this is MRI scan after embolization. Immediately after embolization, you can see that the spinal cord definitely looks better. The flow voids, or the abnormal arteries and the veins, are no longer seen on the surface of the spinal cord, and this is what we see after 3 months. The cord becomes almost normal. So in conclusion, what I can see, that endovascular technique is curative for spinal dural fistula. No open surgery is required for this technique until unless there is any specific reason for that. And the diagnosis is very important. Why I want to stress that diagnosis is very important. By the time the patient comes to, they are usually wheelchair bound or even bed bound, because they are not diagnosed. They may go to a doctor which may not be well versed with the treatment of the disease. So if somebody has these 3 symptoms, constipation, difficulty to pass urine, and bilateral lower limb weakness, so the entity like spinal dural fistula should be kept in mind, and the investigation should be done in that particular way. Thank you very much.